Doctor, what do you think about the interview?
It was awesome. I invite everyone to come and get better educated over vascular disease.
Welcome to Nurse Talkcast. Today we have a vascular surgeon. He's an expert in everything related to veins, everything related to arteries, and he's going to tell us about those cases that you want to know about. Welcome, doctor.
Thank you so much for having me.
My pleasure. Could you please tell us a little more about your background?
Of course. My name is Edgar Galiñanes. I'm a vascular surgeon here in South Florida, Miami. I went to med school in Boston University, and I did my vascular training in Baylor in Houston, Texas.
What is the role of a vascular surgeon?
So a vascular surgeon cares for patients who have disease of blood vessels, which can include arteries, veins, and lymphatics. Now, vascular surgeons are uniquely trained in that our expertise goes beyond just surgery. For example, most patients, when they have surgery, they undergo an operation, and then they see that surgeon maybe 1 or 2 times after the surgery, and that's it. Vascular surgeons are uniquely in that we can follow patients in the long term, so we can manage patients medically and surgically if needed. We have a variety of diagnostic studies that include minimally invasive studies, including duplex ultrasounds, angiography, CT scans, and MRI at our disposal. Pending all these, then we can decide whether or not the patient should merit management with medications, possibly a minimally invasive procedure, and if needed, surgery.
Doctor, and what factors increases the risk for vascular disease?
So there's multiple factors. Typically the factors can be divided into factors we can control and ones we cannot control.
Okay.
Ones that we control, the number 1 factor is smoking. Smoking puts you at 12 times increased risk of atherosclerotic disease compared to somebody who doesn't smoke. The next major impactor is diabetes and chronic kidney disease. Okay, after that, then we have high blood pressure, high cholesterol, and then we have other factors such as obesity, inactivity, all right, excess alcohol consumption, and stress. Okay. And then we have factors that we cannot control. Obviously, this is going to be genetics, gender, all right, ethnicity, and so forth.
Doctor, let me ask you how the excess of alcohol contributes to that issue, which is vascular disease.
Thanks for asking me. So, excess alcohol can lead to high blood pressure. Essentially, you're retaining some fluid, all right, and all that sugar in there gets converted to fat.
Doctor, how vascular surgeon can prevent and treat stroke?
Early detection with medications, either in minimally invasive procedure or surgery. It's imperative that you see, if you're considering, if you think you may have had a stroke or you have a high risk factor of stroke, such as family history, or you have any of the other risk factors we talked about, such as smoking, high blood pressure, high cholesterol, you should seek out a vascular surgeon. We're trained to identify signs and symptoms on a physical exam, and if we need be, then we can order certain tests, such as a duplex ultrasound or possibly a CT scan or MRI to confirm our diagnosis. Then, depending on the degree of blockage that we find in your artery, then we can either manage it with some medication,
okay,
or possibly put a stent in it, or if it's really bad, you may need a surgery.
How do you explain in cases of amputation when you have to give that news to your patients?
That's a very delicate subject. First and foremost, in most cases, I've been following the patient and I'm able to establish a rapport, a confidence with the patient. And we've been leading through this process, or journey, better said, together. So when the time comes to talk to a patient about amputation, I typically, the first and most important thing is be honest.
Yes.
Be honest with the patient. Communicate the severity of the situation. And in most cases, the patient will come to understand.
Doctor, and how often a vascular disease could lead to amputation?
So in the United States, it's estimated that almost 500,000 amputations are done yearly. Now, 40% of those amputations have patients with underlying vascular disease. What's estimated is 1 in 10 of those patients with vascular disease will lead to amputation. Risk factors that increase risk of amputation in those patients are smoking, diabetes, hypertension, and hyperlipidemia.
What is aortic aneurysm?
So an aneurysm is an outpouching of an artery. Now, what's dangerous is if it gets big enough, it can lead to rupture and eventual death. Now, an aortic aneurysm is an outpouching of the largest artery in our body, which is the aorta.
Why is aortic aneurysm one of the most difficult surgeries that you can do?
So the aorta is the largest artery in the body that runs from your chest and belly. And as you can imagine, it runs through significant vital structures, your heart, your lungs, your stomach, your intestines, your liver. So in order to repair that, the surgeon has to take into account and protect and make sure that he doesn't damage or injure any of those vital organs while repairing the aortic aneurysm.
How car accidents and injuries can cause vascular trauma?
So there are many forms of vascular trauma. Essentially, it's easy to think about vascular trauma as a disruption of what the artery or vein is doing, transporting blood to the vital organ. For example, a person in a car accident in a rapid acceleration deceleration injury can have injuries to multiple arteries in the body, which can result in internal bleeding. In these cases, vascular surgeons would need to repair these arteries to prevent death. There also may be certain other types of injuries, such as a fall or a crush injury that you may see in industrial accidents, where an object lands on the patient, most likely in the extremities, and that can cause disruption of blood flow to that extremity, can result in amputation. In that case, the doctor needs to rush in and restore blood flow in order to prevent amputation.
What are the signs and symptoms of a vascular trauma after, especially a car accident and a fall?
So vascular trauma can result in obvious or subtle signs. The obvious ones are severe uncontrolled bleeding, expanding hematoma, or severe pain. In those cases, you need to go immediately to the emergency room. In more subtle signs, typically this results in numbness, pain in that affected extremity, or maybe abdomen. In those cases, again, I would tell you to go to an emergency room and seek out medical attention.
What diagnostic tests are necessary to prove that there was a vascular damage, and especially post-accident?
So vascular surgeons are trained to identify signs and symptoms of vascular injury. A quick screening test that can be used once a patient has an accident is called an ankle brachial index. That will let the vascular surgeon know whether or not there's an injury to that affected extremity. After that, then the vascular surgeon may then decide to order a further study, such as a duplex ultrasound, a CT scan, or MRI.
How a vascular surgeon can help in catastrophic traumatic cases?
So rapid identification of vascular trauma is essential for reducing the resulting amputation. So a vascular surgeon would need to do an adequate physical exam, perform the necessary studies, and if there is a true vascular emergency, then rapidly the patient would need to be taken back to the OR in order to establish blood flow to the affected organ or extremity in order to salvage the patient. Now, there are some cases in where, let's say, there is not an immediate injury. In those special cases, the vascular surgeon typically allows the trauma surgeons to stabilize the patient and then come back within 24 to 48 hours in order to fix the underlying vascular injury. Then there's obviously other cases, such as, let's say, an example, a crush injury, where a patient may experiencing swelling or pain maybe 2 to 3 weeks after the injury, in which case the patient would be best sought off with doing some diagnostic studies. And you may identify, let's say, a blood clot or maybe a lymphatic issue that may need to be addressed at a later date.
Doctor, what is your experience with trauma cases?
Well, as a vascular surgeon, you're adequately trained to handle vascular trauma. But my training goes beyond that. I'm also a trained general surgeon, in which time I spent 5 years where I also practiced trauma surgery. So I experience all types of penetrating and blunt trauma. So I have a vast experience in trauma surgery.
Did you know that a vascular surgeon is able to help you with those spider veins and varicose veins? He has the solution.
As a vascular surgeon, I can treat all those spider and varicose veins, making sure that none of that is in sight. And ironically, as a vascular surgeon, I can do all the treatments without any incisions. All these procedures that we do on the veins, which include the radiofrequency ablations and the phlebectomies and the vein injections, can all be done percutaneously. That means just with a needle.
Doctor, could you please explain what is a DVT and the complications of a DVT?
A deep vein thrombosis is a DVT. This results in a thrombus inside the vein, and typically it occurs in one of your extremities, most commonly the legs. The complications of a deep vein thrombosis is that it can result in what's called a pulmonary embolism. Essentially, the blood clot in your leg travels to your lungs. In the lungs, and that can prevent vital oxygen getting to your lungs, and it can cause a death.
How this interview can help everyone that is assisting us right now?
Education. I hope from this interview that patients will be able to identify whenever something may be serious or they suspect something serious, and they can then seek out medical attention.
We just finished this interview with Dr. Galinanes, everything related to vascular surgery. Come and watch our interview. Doctor, what do you think about the interview?
It was awesome. I invite everyone to come and get better educated over vascular disease.